I'm your host, Cortney, and I'm here this week with Chana Ross.
Hi.
And she is a pelvic health physiotherapist. So she is here today to teach us all about prenatal and postnatal pelvic health.
That's right.
All right, so let's pop open some bubbles. Hannah just had a baby and she's breastfeeding, so we are drinking the sparkling juice today.
But we're going to pretend in our minds.
We're always pretending. All right.
And now the strength test.
You know what? These ones are pretty easy to open.
Pretend.
I say that as this one keeps getting harder and harder as I bring it up. All right.
Woo!
Woo! All right.
Oh, and it does the nice.
I know. Isn't it cute?
Yeah. Thank you.
All right. Well, cheers.
Cheers. Thanks for having me.
No problem. Thank you for coming.
Oh, it's really good.
It is good.
Delicious. It's peach.
Peach.
I like it.
All right. So let's talk a
Do you
little
have to
bit.
talk or can I just keep drinking?
Go ahead.
I'm just going to keep drinking it. It's so good.
It is really good. The apple one is really good too. The pomegranate one's a little too sweet. So let's talk a little bit about your background and how you ended up getting into pelvic physio. I didn't even know that was a specialty.
So
I heard about you.
I'm a I started off in regular physiotherapy. So I've been a physiotherapist for almost 12 years now. And I was actually, so I have 4 kids. My new baby, she's 3 months old, Molly. She's my 4th. And I had my kids almost like every 2 years kind of after going through school. And around, in between my 2nd and my 3rd baby, I started to have some pelvic pain. And I was working at a regular sports medicine clinic, like doing like what you picture physiotherapists do.
Yes.
That's what I was doing. I was working with back pain and neck pain and sports injuries and that kind of stuff. And I had my baby and I had a friend who was working with me at that clinic, and she was sort of branching out and starting to get trained in pelvic health. Up until that point, you couldn't really get trained in Canada. You have to go to the States. So that's why it's really, most people don't even know it exists because the training was in the States prior to this. And I was having a lot of pelvic pain. And she said to me, why don't you just come and I'll fix you. And the thing is with pelvic physiotherapy, and this is something that throws off most people, is that there's an internal assessment. So we call ourselves the gynecologist, the physiotherapist. And I was like, are you sure? Like,
It's weird,
the very
my
concept,
friend.
right? Like, the very concept was kind of like, oh, I don't know. And, I was in a lot of pain, and I had seen my doctor, and my doctor told me everything was okay. And I didn't feel okay. And I went to see my friend, and after a couple of sessions, I did my homework. Like, it was night and day. I felt she really changed my life. And if me, the physiotherapist, if I didn't know that existed, and I thought there was no hope for me, I can only imagine how other women were feeling. And at that moment I was like, I want to do this for other people.
Okay, so we're talking all about the pelvic floor, and I'm sure if you're pregnant or you've had children, you hear the word pelvic floor all the time, but what exactly is the pelvic floor?
So I think when people hear pelvic floor, your first thought is Kegels, basically, right?
Yeah.
That's what people think. But the pelvic floor is actually 3 layers of muscles. Okay. Like the bicep muscle is 2 muscles put together. The pelvic floor is 3 layers of muscles, and they sit at the base of your pelvis, almost like a bowl. So literally, if you put your hand on your crotch and you sit on it, you're holding your pelvic floor.
Okay.
Inside the pelvic floor muscle, so that little bowl, women have 3 orifices. So we have urethra, vagina, and anus inside, and those are all muscular.
Okay.
So the muscles basically attach the front of the pelvis all the way to the back, and side to side from one sits bone to another. And they have 5 jobs. Ready? I'm going to go through all 5 of them, okay? So, job number 1, and I kind of alluded to this before, is they have a sphincteric function. So, sphincter muscle is a muscle that's circular, and when you squish it, it closes.
Yes.
Right? And we have them throughout our whole body. We have them around our urethra, where our pee comes out of, and our anus, where our fecal matter comes out of. Mm-hmm. And we should have the ability to hold on to that stuff when we don't want to go, and actually release when we do want to go.
Right. So
any leaking of urine or feces, or even some women postpartum feel that they have a gas problem. They're like, I don't remember releasing so much gas. Mm-hmm. All of those are a sign that those muscles are not working. Okay. On the opposite end of the spectrum, constipation. So not knowing how to release those muscles is actually often a pelvic floor issue as well. Okay. So that's job number 1. The second job of these muscles is to participate in healthy sexual function. Okay. So we know that people talk about Kegeling to enhance sexual function, but what we actually don't think about is that these are muscles like any other. Mm-hmm. So just like your muscles can be weak, and that's when people say do Kegels, are thinking these muscles are weak, you have to strengthen them, that's why they're not working. Mm-hmm. These muscles can also be too tight. So when you deliver a baby vaginally, very often these muscles are like, right? That's my technical. That's my technical term.
They hate it just as much as we do. It's not good for them.
I mean, it's normal, it's natural, it's beautiful. We'll use those terms. But there is a certain amount of trauma to those muscles. Right. And we have to train them after the fact. We have to treat them the same way that if your back went into spasm, you would put heat on it, you would get a massage, you would treat those muscles. And yet, after you deliver a baby vaginally, they're like, all right, well, see you in 6 weeks. And then women go on and they have terribly painful intercourse. And, everybody says, just have a glass of wine beforehand and it's going to be okay. And that actually doesn't help you. Right, it doesn't help you if the muscles are in spasm, right? So, painful intercourse and healthy sexual function is a really important job of these muscles. Okay, that's only job number 2. So we've got job number 3 with me, so we're gonna keep going.
Keep going.
All right, I'm gonna take a swig of this deliciousness. Okay. Job, it really is very delicious. I know. Job number 3
might be my favorite of the 3 flavors.
Is supportive. So these muscles hold everything up. So we talked about how there's 3 orifices. There's your urethra, there's your vagina, and then there's your anus. On top of your urethra sits your bladder. Okay. Right behind it, on top of your vagina, sits your uterus. Right? We know that because we deliver babies very often through there. And on top of your anus sits your rectum. Right. So they're kind of hanging out, held up by this bowl of muscles. Right. If these muscles are not doing their job, they start to sit lower and lower and lower. And very often it can take almost between 10 and 20 years for those organs to start to descend. And so we hear women who are around, menopausal age, they're starting to have hysterectomies, bladder lift surgeries, a lot of surgeries to actually take these organs and lift them back up to where they were. Right. But these muscles, they're muscles like any other. Use them or lose them. Right. So if you're not training those muscles, they're not going to be doing their job of holding up those organs. Okay. But the good news is you can retrain them. The 4th job of the pelvic floor is actually a sump pump role. You have veins in your body, and it's their job to take blood that has the oxygen removed from it and bring it back up to the heart so that it can get pumped to the lungs to get more oxygen. Okay. Every single vein in our body courses through muscles, and every time you contract those muscles, it kind of pushes the blood flow up, and the blood sits in these one-way valves just waiting for the next muscle to contract and continue that pushing upwards. We have 2 muscles in our body that are considered sump pump muscles. So that means they have a little bit more contractile ability, a little bit stronger pumping action to help with that return of blood flow back to your heart. Okay. And those muscles are actually your calf muscles, which is why on long flights you'll see people pumping their ankles and stuff like that. But our pelvic floor muscles are actually the other sub-pump muscle.
Okay.
So if they're not able to pump and release and pump and release, meaning contract and release like muscles do, we're actually starting to compromise the return of blood flow back to our heart. I think that's very cool.
Kind of scary, really.
Yeah.
When you think about it.
When you see, whenever I start to talk about this, I don't want to be misleading. However, when you see, women with varicose veins, especially during pregnancy, that's the veins. Those are veins that aren't able to do their job quite as well, right? They're stretched out. They can't return the blood quite as well. And often, there's genetic contributing factors. There's lots of other factors, but part of it is that blood is just sitting there, right? And during pregnancy, we have more blood flow, and it's even more important to make sure your pelvic floor muscles are working properly so we can get that blood flow back up to your heart and also support those organs, which are getting heavier and heavier, right? Yeah, such a beautiful time. The last job of the pelvic floor, and this is by far my absolute favorite, is that it's actually part of our inner core musculature. So if you ever go to an exercise class and they'll say to you, engage your core, engage your core, engage your core, it's a little bit misleading because we have 4 layers of abdominal muscles. We got our 6-pack muscles. We all have our 6-pack muscles. Right?
Sometimes they're not always visible, but they're there.
We have our inner and our outer oblique muscles.
Right.
And we have our innermost abdominal muscle, our transversus abdominis. So when they're saying engage your core, those outer 3 muscles they're really important. Mm-hmm. They are, they're really important for movement. They're helpful for, lifting heavy things. But our core is actually our pelvic floor muscles, that innermost abdominal muscle, our innermost back muscle, and actually our breathing diaphragm, our breathing muscle. And those 4 muscles need to work in a coordinated way. And they need to be strong and flexible in order to support our backs, in order to ensure that all those other 4 jobs are getting done. Okay. So in an ideal world, what should happen is your diaphragm is kind of upside down U-shaped, like this. Yeah. Okay. And it sits underneath your ribs. Mm-hmm. And when you take a breath in, your lungs should actually expand, right? Right. When you breathe in, your diaphragm kind of pushes down to create a negative pressure for your lungs to expand. And it pushes into all of your abdominal contents, our 6-pack, your intestines, your gallbladder, your spleen, all that stuff gets pushed down when you inhale. And what should happen is your pelvic floor muscles, which again sit right at the base of our pelvis, should actually relax. Okay. And then as you exhale, your diaphragm will spring back up because your air comes out, and your pelvic floor muscles should actually engage your inner abs and your inner back muscles. And it's this beautiful dance
that's why happen. When I'm employees, I always say that if you just sit and do a breathing class, you'll actually feel it in your core.
Yes. Yes.
Okay.
Yes.
So they're not lying about that.
They're not lying. They're not lying. You should continue going to that class. What often gets missed though is when women have leaking, when you're having symptoms, people, we just pelvic floor focus. We get focused on, okay, what are those muscles doing? Are those muscles weak? Let's strengthen them. Are they tight? Let's lengthen them. But the other, the really important job of those muscles is to work together with this system. Yeah. So as pelvic physios, we're actually obsessed with breathing. And we teach inhaling and relaxing your pelvic floor, and we teach exhaling and engaging it. So if when you have a pelvic floor assessment, they check and they see what are those, why are you leaking? Are you leaking because those muscles are too tight and they aren't unavailable for you? Like if you did a bicep curl, right? I can't do another bicep curl without releasing that, right? But you don't know, your pelvic floor, we can't actually know what's happening unless we assess what's happening.
Now that the focus is kind of shifting and we're realizing the importance of pelvic health and pelvic physio, do you hope that one day, or do you foresee one day that this will get integrated to become a part of your regular prenatal and postnatal care?
So in France and many parts of Europe, there are 10 visits covered by the government for pelvic physio after having a baby. And the reason why I think that is so brilliant is because, number one, it costs the government a lot for us to, for women to have these surgeries years down the road. By focusing on prevention, we're actually helping our citizens live healthier and more vibrant lives. They could be, contributing members of society. Instead, when women are experiencing these symptoms, it truly affects their sense of self and self-worth, let alone the healthcare costs.
Right. So like mental health as well, and how they
100%. And so what I would love it. I would love it that was standard of care. That would be unbelievable. I think we'd be doing our country and our communities a great service. It just makes sense to me from everything that you said. It makes sense. The prenatal care, we're trying to look after the baby, but it's equally important to be looking after the mom as well. Yeah. By virtue of the fact that postpartum, most of our appointments are focused on the baby, it pretty much sends a message to the mom that
you are no longer important.
You're done your role.
You're second class citizen now. Yeah. Minus the one little question they ask where they're like, how's mom doing?
Right.
And 90% of us, even if we're not doing great, we go, oh, we're great. Because we think we should be doing great.
Yeah. We're supposed to be doing great.
It's supposed to be the best time of our lives.
Right.
But from what I've gathered is please share this video, because I don't think anybody, except those who have gone to pelvic physio or are pelvic physiotherapists, know how important it is.
Yeah. And you don't realize it until it's almost too late. It's never too late, but don't wait until there's an issue to get assessed.
Exactly. Right? And if enough people get on board and enough people push and advocate for it, maybe we can make it a part of our regular prenatal care.
Let's do
it. You know what I mean? Okay. So you have a clinic here in Toronto.
Vital physiotherapy.
And if you're not in Toronto, then just Google pelvic physiotherapy.
Or contact me and I'll help you find somebody.
Exactly. So in the link below, or in the description below, I will include links to your social media as well as your website. And I definitely highly encourage to follow Hannah on social media, whether it be on Instagram or Facebook, whatever you prefer, because you guys do webinars and things like that,
so
specifically catered. Because there's been a lot of information today. Maybe you don't want more information about all of it, but you can find something that's more geared towards you. And then if you are in the city, you can make the phone call and go give you a visit.
I love it. And I do think that as somebody who is in a profession that many people don't know about, but that I think is very important, I think it's incumbent upon us to help educate people about their pelvic health. So definitely we have videos on Facebook. We have, we've got a lot of stuff going on to try to help educate people as well.
Yeah. Thank you so much for coming.